had the greatest job in the world, and that's working with dogs.
Best in Show winner is the French Bulldog.
Winston won the National Dog Show. It was amazing. It was exciting. And to have a dog to be #1 dog in this country, you have to have great nutrition. And I always fed Pro Plan. Just like us, when we eat well, we feel good. And I just love that food and what it's done all these years to all the dogs I've bred and all the dogs I've shown.
Welcome to Pure Dog Talk. I am your host, Laura Reeves, and my dear friend, Dr. Marty Greer, and I are here together today, and we're talking about something that in the pantheon of things, the corporate takeover of veterinary clinics that we talked about on last month's podcast. One of the things that I wanted to, and you and I kind of discussed, and I wanted to touch on for a lot of our listeners, because so many people in our audience in purebred dogs also work at a vet clinic, are a veterinarian, are a veterinary technician. You have, as you mentioned, a hugely successful veterinary practice. You have rescued at least one, if not, didn't you tell me, 2 different veterinary practices that just the veterinarian threw up their hands and walked away, and kept those in business for people in need of veterinary care in that area. Talk us through the 5 top things that any veterinary practice can do to make their practice more cost efficient, effective in meeting client demands, whatever it is. How do you keep these practices in business?
Well, probably the most significant thing that we have been blessed with is to become part of a veterinary management group, VMG, veterinary study group. If that appeals to you, great. If you qualify, great. If you don't, there are other choices. There is an organization called the Independent Veterinary Practitioners Association, IVPA. But these organizations give you an opportunity to have a buying group and education on how to manage your practice, how to do a better job of being a business person. Because most veterinarians come out of veterinary school without a lot of experience in practicing. They understand how to do the medicine. They don't know how to do the business part. I remember being in vet school and they tried to teach us and we were like, no, we want to just be a doctor. Well, that was kind of short-sighted. And a year out of vet school, I started a practice. And I'm like, I should have been listening. I missed it. But I was blessed enough to have a father that's a salesman and supportive of me, and a husband that was supportive. And so we were able to make that happen. So number 1, join IVPA, join a VMG group, join some other buying group so that you have the opportunity to improve your cost of goods, to understand the management techniques and principles. So that's number 1. Number 2, get a great accountant and a great attorney that understand the veterinary practices. There are many veterinary specific accountants and veterinary specific attorneys. Use one of them. If you have trouble finding one, I'll help you. Call me, email me, I'll help you. Because having a veterinary specific attorney, I don't have to wonder if my numbers are right. I don't have to say, can I buy this piece of equipment? I will call up my accountant and I will hear him on his adding machine in the background. Yep, you can do this, and this is how you structure it, and this is what you do. And so, can I afford it? How do I structure the fee? Do I lease it? Do I buy it? How do I do this stuff? So get yourself a good attorney and a good accountant to help you. If you're still struggling, find a mentor, a veterinarian that will help mentor you. I'm happy to do that. IVPA is happy to hook you up with somebody. There's lots of people out there that will help you. They may not be in your neighboring practice, but because you're competition for them. But there are people all over the country that are willing to help you out. And so the VMG groups and the IVPA, fabulous. If that still isn't getting you where you need to be, hire somebody that will be a practice consultant. There's an organization, Veterinary Partners. They have consultants in all aspects of veterinary practice. All the really top people are hanging out together. They meet twice a year. They meet at VMX and then they meet at one of the other meetings a year. Get your honey in the chair. Spend the time. You have to spend time working on your practice, not just in your practice. So get your honey in the chair at those events. Figure it out. Go to one of the big meetings every year. Figure out who the people are that you think like, that you like the way they approach managing a practice, and get yourself a consultant. We hired a consultant. Oh my God, we had like two nickels to rub together. We hired a consultant. It changed our practice. We got the opportunity to join a VMG group, which at one point 15 years ago was still pretty hush hush. Nobody talked about it. We really didn't know who these people were. Again, it changed our practice. We were really lucky that we were in the right place at the right time for a lot of these things to happen. So I'm just going to say, if you're struggling and you're trying to get your practice up and running, figure it out. You've got clients that are really good at this stuff too. So, great. And then start going to things like what is it? Toastmasters to, yeah, or a Dale Carnegie class. I mean,
Chamber of Commerce.
yeah, join the chamber, become known. I took some business classes when I was in practice, in my early years in practice at the local community college. They weren't expensive. Did I have to take time from my family to do it? Uh-huh. But you know what? 43 years later, we're still in practice, which is kind of good because most businesses fail in the first 5 years. So here we are, out pretty far, and we are in a position to, like you said, rescue some practices. We literally have rescued, and I use that word carefully because I'm not crazy about the rescue stuff that I hear people talk about. But there are things that you can do to make this happen. So figure it out, man. It's the way it goes, and learn who these resources of people need to be, and then hire yourself a practice manager. It's really hard. It's really hard when you don't have enough money, you can't figure it out. Hire somebody to help you with your HR and with your bookkeeping and with all the parts of practice that you have to have, because that practice manager can be a godsend. It might be an office manager, it might be somebody that's not full-time as a practice manager, but they can really make a difference in your practice. We just hired a person to help us with our HR. She's flunked retirement multiple times. I'm not sure how old she is, but she's well above 70 and she still wants to work. Find somebody like that that's willing to do it, and then realize that you don't have to own the practice all by yourself. The hardest place to be in practice is to be at a 1.5 doctor. When you're not quite busy enough to hire another doctor, you're not quite busy enough to hire a manager, but God, you're drowning. You're just drowning in all the things that are happening to you. Trying to run your family and your dogs and your life, and there's all this stuff. Just, it's like drinking from a fire hose. But you don't have to do it alone. Find a classmate, a colleague, find somebody that wants to practice with you. Find a practice manager that wants to work with you, because they will. And in many states, you don't have to be a veterinarian to own a practice. So affiliate with somebody that wants to be part of the business and do it, because you can. I mean, you're not going to lack clients. There's too many clients right now for the amount of care that we have. So there are plenty of clients out there. Figure out how to do the business part. And if you have trouble, call me. I'll get you hooked up with the right person, man. Don't hesitate. But you can make this happen. And a lot of people are afraid to start a practice because they think that because they have student loans that they can't afford to start a practice. And in reality, owning a practice is proven to be the fastest way to pay your school loans back, because the profitability is better as an owner than it is as an employee. So I hope that answers some questions.
No, that's good. So again, our goal here. So follow up to last month's episode. Our goal is avoid corporate takeover. Don't So I mean, part of what I know, having discussed with my friends who are veterinarians, particularly in more rural areas, finding these vet students out of vet school that we just talked about last month that all want to go into shelter medicine, finding one that actually wants to practice and wants to practice in a small rural area
Right.
can and not practice for the kind of money that they could get working at Blue Pearl or something like that.
Yeah, but working in those corporate practices, you are told how to practice medicine, you are told how you have to do things. And the advantage of being in an independent practice is you get to practice the way you want to and practice the kind of medicine that appeals to you. We have a sign on the wall, WWJHD. What would James Harriet do?
So
I
cute.
love that
So
because I
cute.
I want my staff and my doctors to think about what's what fits the needs of their client and their client's pet. It's not about our protocol is every dog that comes in vomiting gets blah 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 blah. You can write those procedures in your own practice, but then you adapt them. We guarantee our clients that we will adapt to their needs. And if they can afford this, they get this. And if they can afford this, they get this. And nobody's going to give them a hard time. So you have to find a place in your soul for how you want to practice. There is an organization, the Society for Veterinary Medical Ethics. So if we have a veterinarian that's struggling with being in a corporate practice or being in a practice that doesn't meet their needs, they have SVME that they can become a member of. They have a course and they have a listserv, and we have people that are willing to help them out. We have the American Vet Med Law Association. If they have a legal issue, we can help them find somebody. There's all these resources out there, but if you're so overwhelmed with the stuff that's happening around you and you don't get a chance to pick up your head, look around and figure out how to get help, you're going to feel overwhelmed. So find a mentor that's going to help you. Join some of these organizations, and they're these are wonderful people. I'm in all of these organizations. They're wonderful people that want to help you. So don't feel all alone out there. We have Not One More Vet. We have all these organizations. They're all out there to help you. There's classes you can take on how to deal with euthanasias. I mean, there's all these resources. Don't feel like you have to go this alone.
Trupanion is revolutionizing medical insurance for pets by providing the best possible experience to our members. And it's not some space age dream, it's happening now. We pay your veterinarian directly while you're checking out, and we're the only ones who can, which means you have decisions in seconds, and you don't have to wait for reimbursement. So unlike with other providers, you'll keep more money in your pocket. Ask your veterinarian if Trupanion can pay them directly, because there's pet insurance, and then there's Trupanion.
And then I think the next thing I would say, and again, or the next sort of topic I wanted to hit on, speaking to, again, this audience, these people that are listening to us, so many of them are in and around and associated with veterinary medicine. And it's been really fascinating for me as I've watched a friend of mine going through working in a veterinary practice and some of the issues that she's run into and the things that are hard for her, and I think that I would love to speak a little bit. I know we've touched on it before, but I really feel like we can never say it too many times. The Not One More Vet. If you
Mhm.
could speak to that a little bit, because I think it impacts veterinarians and staff.
Mhm. Right. There's Mighty Vet, there's Not One More Vet, there's several organizations out there that help with mental health, and there's non-veterinary organizations as well that'll help you. If you work in corporate medicine, they oftentimes have as a benefit an EAP, an employee assistance program,
Mm.
that's included in the benefit package that you work in the practice. If you don't have that, for instance, the Wisconsin Veterinary Medical Association has an organization that helps without having any cost associated with it. So
Mm.
look for the resources that are out there, and if you don't feel like you can find them, find somebody at your local VMA, at the AVMA, at some level of organization, because someplace out there are resources that are willing to pitch in and give you some help. So don't feel alone. Really, and sometimes you have to open up to people in a way that might be difficult, but once you find that they understand you in a way that you didn't think they would, they probably have been through some of the things that you're going through, because we all have bumps in our career lives where things don't go the way we want them to, whether it's business, medicine, personal.
Mhm.
We all have had our struggles. Nobody has a perfect life. And so realize that there are people out there that will help you and will pitch in if you expose yourself enough to say that you need help. Go back to your veterinary school, but go back to the school that you graduated from and see if they have somebody in the counseling department. There's lots of resources out there that don't have to cost you a lot of money. So find them and don't let yourself become overwhelmed, because we're all out here to help you. You're going to find a veterinary mentor that will help you. They're good. The veterinary field is full of really genuinely great people in a way that we don't see in a lot of other career choices. It's an amazing field to be in.
Yeah. Okay, so following that, then, as clients, speaking
Yeah.
of all the rest of us that aren't actually actively involved in veterinary medicine, from the doing it end, but the receiving it end, what are, I mean, I can speak from my personal experience. The what do we call it? Like the choke points, right? Where are my rubs when I'm dealing with a practice? And famously, and you can speak to this better than I am sure. Inevitably, there's that one person at the front desk that makes life more challenging than they need to for the client, and so how do we work with that?
Well, you need to
What's your
be,
advice to me, to us, to the clients?
yeah, and you need to be honest with the veterinary clinic that you go to. Don't be difficult.
Mhm.
Don't go in there with,
Right,
raging
right.
ideas of how this is going to happen, but have the opportunity to write a note, send an email, meet privately with the owner of the practice or the practice manager if you feel like they're on the same page with you, and explain to them what the problem is. But don't be a jerk, you know? Don't go in there and be a jerk. Be nice about it. Share the information about where your challenges are. And potentially you're not the only person that's had that problem. Maybe you just have to find a different person at the front desk or in the treatment area, in the medical part of things that you need to talk to and get some help so that you can get there. But be really nice. You can write a thank you note. Be overtly and gracious, thankful for the things that go well, and try not to just be complaining all the time about the things that don't. Because I'll tell you, when you answer the phone 40 times an hour and you have to deal with 39 people who are kind of a pain in the butt, it's hard to be nice to the 40th person when everybody all morning has been yelling at you as the receptionist or complaining about something as the technician, or so don't complain about the prices. Don't complain about stuff that, if you want your veterinary clinic to stay in business, they have to make a profit. They have to charge you money. Don't expect that they're going to give everything to you for free. And then be really nice. Like I said, a thank you note, a box of cookies. It doesn't have to be expensive. It doesn't have to be fancy. It, we had flowers delivered last week. This most beautiful arrangement of roses. Absolutely gorgeous. It's really nice. But a thank you note is great if you can't afford the roses. You can always bake something. I mean, I hope you can always bake something. Maybe you're just not good at that. So find somebody that can bake for you. But those little things, just picking up a dozen donuts at Dunkin' Donuts on your way in can make everybody's day better. And I know I've said this before, but you want to be that person when you show up at the front desk with, a pot of coffee and a bunch of donuts, or a pizza for lunch, or something unexpected. And don't just do it at the holidays, because the table at the holidays is insane. Do it, have a barbecue, like go over and make them dinner some night or lunch someday. Like, you don't have to spend a lot of money on this, but it goes so far in being that person
Mhm.
that they're like, oh yeah, remember the last time she called? She brought us pizza. Not, oh God, she's the one that always calls 5 minutes before we're closing and needs an emergency C-section. Please don't be that person every time. There will be times that that has to happen. But if you're not the person that's got the worst emergency and somebody has one worse than you, if there's somebody in badder shape than you are, sit down, be quiet, and let them take care of that person first. Because I'm going to tell you, you're going to be next. And it's going to be a really good thing that you were kind and polite to the person who had something more serious going on that day, because someday it's going to be you. And I
Yeah.
actually had this happen 2 weeks ago. I had a client that had a very serious emergency. And the other client, I went in the room and I said, I need your help with this. I need to know how you feel about this. This person needs an emergency C-section, and your C-section is not emergent. How do you feel about us knocking this out quick before we do yours? And they're like, oh yeah, because last time it was us. So remember, it's going to be you one of these days, and you'll want somebody to step aside and be that person that lets you go ahead in line. So it's not all about you every time you go in. Be nice. Think about the other people that are there. Even though you may not see the emergency, trust me, if they say they got one, they got one. It's the bloat, it's the hit by car, it's the emergency C-section, it's the whatever it happens to be. And your vet clinic is working as hard and as fast as they can to take care of everybody. So be nice.
Absolutely. Okay. Well, we can't solve all the world's problems, Marty, but we can
Oh, no, we
we,
can't?
we can always try.
Okay.
And so there you go. Corporate takeovers and avoiding corporate takeovers. That is our back to
Well,
school fall topics for our
yeah.
veterinary
And
voice.
we actually have one of your patrons that has said, you know what? Instead of watching corporate takeovers, maybe as a group of breeders, we should buy a veterinary practice
Yeah.
and support it. As a kennel club, you can put scholarships together that can be perpetual scholarships to help veterinary students so that when they're in school, they don't just hear about breeders being bad people. They're like, oh, you know what? They're giving $1,000 scholarship or a $5,000 scholarship this year. I wonder what that kennel club is really all about. So think about the ways that you can positively impact young people that want to go into the field. And if every time you go into the practice you're complaining, you are not positively impacting their future. So and it's not just the doctor. Be
Mm-hmm.
nice to everybody on the staff. It's not just the doctor. It's the person who has to clean up after you. It's the person who has to stay
Don't let
late
your
because of
dog
you.
pee on the counter while you're waiting. Ah.
Yeah, please. That is why veterinarians hate breeders, is because all their male dogs come in and lift their leg on the counter. Don't be that person.
Don't be that person. So I'm following up on your scholarship idea. Podcast listeners will remember this goes back a couple of years, but
A while.
Chris and Tom Levy endowed
Yeah,
a thing at the Oregon State University
yeah.
in their veterinary school. If you have the resources to do that, there's a way to perpetuate um, the idea of dog breeders and purebred dogs being a worthwhile thing at the veterinary school near you.
Well, add $1 onto your entry fees for your events and start a scholarship fund. Think big and think thoughtfully about what you can do to give students the support. And like I said, you want to be the kennel club that they're looking at going, who is that? Like, what does a kennel club do? Not, oh, yeah, not those people. So, really think about the things you can do. We have a model set up in Wisconsin to do scholarships. There are other models out there. So, think about how you can make positive effects on people. Think about how to keep your practice in business. Don't go in and complain about every nickel that you've spent there.
Mhm.
No, you don't own a wing. You think you own a wing. You do not own a wing at your vet
I
clinic.
always feel like I put somebody's kid through college. I just
Yeah, no. And you didn't buy them a new boat. You didn't
no,
educate all six of their children. No, you didn't. You may think so. You spent, $200 there last year. No, you are not their best client. Sorry. We know who our best clients are, and they're not. Hopefully, they're the nicest clients as well. The people you really want to work with, and we're very blessed in our practice to have that. But
yep.
it takes some cultivating of that, and you have
But
to
I think
you
that's a
have to.
two-way street too,
It
right? So
is
the communication,
absolutely.
how you communicate to your clients, how your clients communicate to you, that is so I mean, we say that education is the answer to everything. I would double down on communication is the answer to everything.
It really is. And great communication is important. So, send emails, answer your. We have people that come in, we send them emails to remind them of things and text messages, and they're like, I never got that. You probably did. So pay attention to those. Don't refuse to answer the phone if you see an unknown number coming up. Pick up the phone. It's probably your vet clinic. Just think about it. If it's not your vet clinic, if it's somebody trying to sell you something political, just politely hang up. But answer the phone when your vet calls. Don't say, I'm at dinner. You know what? I'm still at work. I don't want to. Don't tell me you're
I would
already
like
eating
to
dinner
have
because
dinner. Thank you very much.
I got 3 hours of work to do before I get dinner. So don't be whining, because I'll call people and say, is this the Reeves residence? Who is this? Well, this is Dr. Greer. Did you want to talk to me or not want to talk to me? Because if you don't, that's okay. I'm good. Oh, I'm so sorry. Be nice, people. Just be nice.
The world could be a nicer place. I'm just saying, all the way around.
And we've lost a lot of decorum during COVID. So try to remember how your parents taught you to answer the phone, how they taught you to talk to people. Try to remember before your mother whacked you on the back of the head.
Try to remember that once upon a time we had manners, and it was
Yeah.
not a bad thing.
Whap. That's right. Whap. Stop talking like that.
Yeah. Whapped upside the head, or your mother's gonna take you and she's gonna spit in her hand and like scrub your face before church, because if you've never
Yeah.
had that happen to you, I promise.
Oh yeah. Oh yeah. I mean, when I was a little kid, if my mother was waiting for a phone call from the doctor, you did not answer the phone. You did not talk on the phone. When we went to the doctor's office, we wore a dress.
Yes.
We were dressed appropriately. We did not wear our pajamas to the vet clinic. We looked nice. So try to remember those days when you were a kid of how your mother expected you to behave, and try to remember that your mom is still looking
Applies
over
to
your
your
shoulder.
vet, to your tech, to the other people in the dog show ring, to the dog show judges, like all the way around, people. Yo,
Yes.
really?
Yes.
Like,
Right. Behave yourselves. Mm-hmm. Yeah.
all right. Thanks, Marty. Here we go. Just a little bitch slap right here. That's it. We're done. Have a good night.
Bye. Thanks.